Everyone. My name is Leslie Dock, and I am the chair of Protect Our Care. It's an honor to be joined today by two secretaries of Health and Human Services, Donna Shalala, who served for the full 8 years of President Clinton's term, beginning in 1993, the same time that Attorney General Becerra joined the House, and they got a chance to work together for that entire time period. And by Secretary Kathleen Sebelius, who served in the Obama administration beginning in 2009, oversaw and fought for the passage of the Affordable Care Act and its implementation, both of whom are towering champions of healthcare. I got to watch myself a little bit of the work of the HHS Secretary when I served as senior counselor to Sylvia Burwell for the last few years of the administration and as the department's Ebola coordinator. Before I turn it over to the two secretaries, I just want to make some very brief opening remarks. President-elect Biden has selected a tremendous team to make America healthier and to put as speedy as possible an end to this pandemic. There are folks who understand the science. They are folks who know how to manage. They know how to listen. They will have a plan, and they have the experience to execute it. They will respect the people at HHS, and they will have their respect. They won't make the mistakes that this administration makes. They won't be, they won't make decisions not to buy vaccines and instead to ship them overseas. They won't muzzle the scientists. They will speak with a trusted voice to Americans in a way that they will listen to that advice and follow that advice and help us have a path to a healthier nation. They also understand the importance of the Affordable Care Act, Medicare and Medicaid, and they will support those laws and make them stronger. And with that, let me turn it over to Secretary Shalala.
Thanks very much. Thanks very much, Leslie. Let me say that I have known Xavier Becerra since 1993. I've worked with him. He's an experienced policymaker, a skilled advocate, a deeply knowledgeable about health policy, and particularly about the federal role. In this COVID pandemic, we need to confirm him immediately. That means he ought to have a hearing in January. I was confirmed the day after President Clinton was sworn in, as were most of the members of the cabinet. We had our hearings in January. There was no reason, and it's dangerous to dawdle. I've said before, the White House can coordinate the policy on COVID. HHS has to execute it, and it needs a strong leader to execute it, and that's exactly what he is. And I think the combination of his deep legislative experience, particularly on the House side, many of the people that work for Joe Biden, including Joe himself, are experienced on the Senate side. And the fact that he's been deep into the policy-making process in relationship to healthcare, but also HHS is more than that. It's a number of agencies that take care of children, agencies that take care of the general public health, great scientific agencies. Xavier has experience in all of them. And of course, it does refugee resettlement, which has been a mess under this administration. And he certainly has been a fierce advocate there. Let me finally say, the building for HHS is named for Hubert Humphrey. And there's a quote on that building. It says, "The moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, those who are in the shadows of life, the sick, the needy, and the handicapped." I can't think of a better or firmer or more relentless advocate for those groups of people in our society, the most vulnerable, than Attorney General Becerra, and I'm proud to support him. And I hope that the Congress, the Senate in particular, will come to the same conclusion and confirm him as quickly as possible. Thank you.
Thank you, Secretary Shalala. Let me now turn to Secretary Sebelius for her comments.
Well, thank you, Leslie, and thank you for certainly everything Protect Our Care is doing to make sure that healthcare is in place and expanded for millions of Americans. I think that President-elect Biden and Vice President-elect Harris have put forward a very strong, competent, compassionate, strategic health team. As Secretary Shalala said, we are in the midst of really an unprecedented health crisis in this country. So getting the health team in place as rapidly as possible is really important to save lives and to save entire communities. We have in Xavier Becerra somebody who is extraordinary. I had the privilege of working with Javier as we worked to pass the Affordable Care Act. He was one of the key lieutenants in the House. He was in a leadership position and really knows that law very well and managed to put together lots of coalitions in the House caucus that managed to push the law through. Then he has been on the front edge of the defense of the law. So he understands this framework, this most important piece of health legislation that has passed in the last 50 years, both in the legal aspects and certainly in the human aspects. He is a strong advocate for children and families, which is part of the HHS portfolio, and has looked to not only immigrant children, but underserved people throughout his career. He's very aware of Black and Brown communities and the kind of health disparities that we're facing. He will be terrific in that role. He's taken on tough battles, the opioid epidemic in this country, the consolidation of healthcare, which often drives prices higher than they should be for average Americans. So he knows the legal aspects of some of the antitrust features that are there. And I can't imagine a better time for somebody like AG Becerra to come into that office and not only be able to focus on the COVID crisis and the immediate health crisis that we have, but really look out across 11 operating agencies and make sure that all of the assets are on the table for all of the Americans. Americans day in and day out rely on HHS to deliver services that they need and expect in their lives. And he is well equipped, having run a major agency in California, to bring those management skills and that operation to the forefront. I also had the great privilege of helping to make sure that Vivek Murthy was nominated and confirmed as Surgeon General while I was at HHS, and have had the privilege of working with Vivek ever since. He brings unique abilities to that office of Surgeon General. He was excellent for the years that he served. But in the meantime, he's written this amazing book on loneliness and identified the situation that many Americans find themselves in the midst of this pandemic of isolation and loneliness, and the kind of compassion, the kind of knowledge he has, both from his medical field and his writings and conversations in this country, make him very well suited to return to that critical office of Surgeon General and play a key part of this team. So I'm thrilled with the whole team. Dr. Walensky will be terrific at CDC. Jeff Zients, I worked with closely during his term in the Obama administration. He's well suited for the logistics capabilities, but the two members who need quick and immediate attention from the United States Senate are Xavier Becerra as Secretary and Vivek Murthy as Surgeon General, because they need to be in place as quickly as possible.
Thank you, Kathleen. Let me make some final remarks and then turn the call open for questions from those folks who are listening. I want to take up where Secretary Sebelius left off for a second on Vivek Murthy. I also had the opportunity to work with Vivek. He is a empathetic person who understands people and understands medicine. You will be a tremendous asset to explaining the truth about this pandemic and the steps that people can take to stay healthy and get healthy in a way that will be trusted across the country and trusted, as we know, by the president-elect as well. Attorney General Becerra is one of the most qualified people ever to be designated and to be nominated for HHS Secretary. His life and his career in Congress and in state government as a lawyer, as a representative of the people, make him extremely qualified to do this job so well. He understands the ACA. He understands Medicaid. He understands the importance of Medicaid for the working poor, for seniors, for the disabled, for women. He understands Medicare, having served for so long on the Ways and Means Committee. He knows that law in detail, its importance, and how it works. And he has led the fight to protect the ACA over the last several years. And in Congress, he was known as a person who understood the issues and as a person who worked across the aisle. I can't think of a stronger resume for this job. And this team is the team we need as we are fighting the most significant public health crisis in our history, and where the next several months are so critical to a return to our health, but also to get our economy moving again. These are as much economic appointments in many ways as they are healthcare appointments, because until we get this crisis under control, we cannot get people back to work. And if we don't have leaders who know how to plan and to execute and to work with governors, not set them against each other, and who give information that all Americans can trust, we cannot move forward. So I also urge every senator, every Republican senator, to support these nominees and for their confirmations to move forward as quickly as possible. And with that, Mitch, let me ask you to open this up for questions.
All right, so if any of our reporters on the line have a question, they can raise their hand. You can use the raise your hand feature and I will call on you. Okay, our first question is going to come from Carmen Pound at Politico. Okay, Carmen, you should be live.
Yes. Hi, Mitch. Thank you so much for taking my question. I'm a global health reporter at Politico, and I wanted to ask you about the global dimension of the health secretary job. How do you deal with that? Obviously, the health secretary is the top US government representative to the WHO. The relationships between the US government right now and the WHO are a little bit strained. How do you see Mr. Becerra dealing with that, and how, from your experience, how did you deal with the global dimension of your job? Thank you.
Would you like to go first?
Well, I could dive in, and I'm sure Donna wants to add. First of all, at least in our experience, Carmen, we had a designee who was the head of the American delegation at WHO. The health secretary, myself, certainly attended the General Assembly meetings in the spring and participated as the head of the US delegation and had important relationships with health ministers. But in my experience, Tom Frieden, who was the CDC director, was the second designee to WHO. Our initial designee was the head of the Global Health Office, who was also a medical doctor, Dr. Niels Dollaire, who came out of a long international background. So he was the principal point person at WHO. You're absolutely right. We have to rejoin those coalitions. We've not participated in any of the discussions about funding vaccine for underserved countries, developing countries. We haven't participated in the massive global distribution system. And until we get the whole world vaccinated, frankly, this disease will continue to circulate. So the head of the Global Health Office at HHS is a critical position. And I'm sure that as Secretary, Xavier Becerra will make a wise choice along with President Biden in that role. But re-engaging in health diplomacy, in health collaboration is absolutely critical to the United States and to the health of every American.
Yeah, thank you. Let me simply add to that. I spent a lot of time at the WHO, and we actually changed the leadership during that time. It was a chance to build relationships with secretaries, with my counterparts around the world, and I knew them well. The CDC has long had many of its scientists embedded in the WHO, particularly in the infectious disease section. We've detailed people over there. We played a very strong scientific role in the training through the CDC. Many of the health ministers around the world were trained at the CDC in their short courses, sometimes in their longer courses. So while the CDC is the primary relationship with the WHO, the Secretary's Office plays a very important role in terms of leadership. I went there, I spent time, I dined and wined and dined many of the members as a way of both working the politics and strengthening the organization over the years. I had the advantage of 8 years of doing that, so I developed strong relationships. But I think what's important is that we participate internationally because these diseases know no boundaries.
Mitch, you want to go to the next question?
Sure thing. So we have a written submission from Alice Olstein at Politico. She asks, Republican senators are already opposing Becerra's confirmation over his support for abortion rights and the lack of medical experience. How will Biden's team ensure he's confirmed quickly in order to address the current crisis?
You know, they always take on people out of the box. I'm sure the Biden people have already started before having conversations with Republicans, certainly with the Democratic leadership who are having conversations. I was one of the people that Bill Clinton appointed in which the Republicans announced that that I would not be confirmable. It took about a week, and I was confirmed almost unanimously. I think there was one senator that voted against me by the time we were finished. I was introduced by Tommy Thompson, who was the governor of Wisconsin, where I had come from at the time. Mel Laird, I remember the former Secretary of Defense, made a bunch of phone calls. And I did have healthcare experience because I had run a big health system. And I taught the health policy and I sat on the NIH board, but it was ideological that they were concerned about, pro-choice, coming out of a liberal university. But in the end, it sorted itself out once I went to the Hill and talked to people. And I developed strong relationships over the years, as I know Kathleen did, with Republicans members of Congress. So this is the first shakeout. Most of the Republicans that indicated opposition have also indicated some opposition to other candidates that he's nominated or will nominate. So it sorts itself out. And the new administration will work hard to get their nominees confirmed. And don't think for a minute they didn't think about confirmation in the process of selecting these people.
I would just add that I think we have a pandemic underway, and what is likely to happen is delay that they are setting up, and that is a life issue, a life or death issue for way, way too many people. To leave critical positions vacant over political peaks makes no sense. I think that there are, I hope and pray that there are enough Republicans who believe strongly that any election does have consequences, as they said over and over again during the last administration. We saw those consequences up close and personal. We've seen the incompetence and corruption and lack of compassion in what's happening to our community. So I think the same message applies. When Joe Biden is sworn in, he deserves to have his cabinet. He particularly deserves to have competent, capable people who lead these critical health agencies. And I would put Xavier Becerra's health background and knowledge and work up against anybody's. The last healthcare provider that I know of who led the department, I had to resign in 6 months over a scandal, and that was Donald Trump's appointee, Dr. Tom Price. So I don't think medical background per se in the profession makes one an appropriate health secretary. I think what's much more important is to have broad knowledge, management skills, and ethical record that can withstand any kind of questioning and be supportive of the policies that the vast majority of Americans just supported in electing President Biden.
Yeah,
The
but
other thing is, I think my experience on the Hill is that there is some deference to people who have been in Congress that come up for these positions. So I'm sure he'll get an opportunity to respond to some of the questions. He's very skilled and very smart and very passionate about issues that Republicans and Democrats care about.
I just want to add to that, there, as I said, there's really no one more qualified. This is Attorney General Becerra understands the law. He's run a major organization. He served 24 years in Congress. He understands Medicare and Medicaid from the legal text to what it means for people. He has a history of working across the aisle. He knows how to lead, and he will earn the respect of everybody who works at HHS and restore that agency to where it needs to be. So none of these efforts to discredit him have any basis in who he is or the reality of his career and his contribution. And as others have said, I believe that when the sort of noise dies down and people focus and admit the strength that he brings to this office, he will be the next Secretary of Health and Human Services. Mitch?
Okay, our next question is going to come from Heidi Prisbilla at NBC News. Heidi, you are live.
Thank you. To that point, thank you for all your comments more broadly on how you think this is going to work out for him. But one of the criticisms, as well as wondering if you could specifically address, is that Becerra is on the record being a strong supporter of Medicare for all, and they're calling him a big government progressive who will take away the current system. Question is, do you think he has to specifically forsake that position in order to get Senate Republicans to vote for him?
Let me just start that.
He's going to follow the president's lead. And Joe Biden has made it very clear what his position is, and that is to build on the ACA. And I'm sure that he did not take this position without that understanding that his healthcare policy now is Joe Biden's healthcare policy. The vice president had to do the same thing.
Secretary Sebelius, anything to add there?
No, I mean, lots of people who are confirmed to cabinet positions and who are nominated may have voiced or believe certain things when they're in their own unique leadership capacity. But what Xavier Becerra has signed on to do is be part of a team, and the team has a team captain who has just been elected, and and a vice president who has just been elected. So I think there's no question that Secretary of HHS, Xavier Becerra, will do everything he can to advance the policies that Joe Biden put forward, which are to expand and build on the scaffolding of the ACA. There is no better champion for the ACA than Xavier Becerra. He was on the front lines of passing the bill. He has been in the court defending the bill. So he is the perfect person for Joe Biden to put in place as we move to expand healthcare in America.
Thank you.
Mitch,
Okay,
anybody else?
our next question is going to come from Mary Ellen McIntyre at roll call. And Mary Ellen, you're live.
Hi there. Thanks for doing this. I just wanted to ask, the Trump administration has obviously made a lot of their biggest impacts on healthcare during its 4 years through regulations. I wonder, how do you sort of expect potential Secretary Becerra to sort of reverse some of those? And are there policies that the Trump administration has, put forward and put through the regulation process that you would expect him to consider keeping if he's confirmed?
I'm happy to start this. I mean, unfortunately, we've had 4 years of administrative sabotage of healthcare and the Affordable Care Act, as you know, starting, on day one. And while it's premature to predict exactly what the incoming administration will do, clearly issues like short-term junk healthcare plans that deceive people into buying healthcare insurance that won't cover them when they're sick. Work requirements for Medicaid, which go against the core principle of that law, which is to preserve health, and which we know actually get in the way of people being able to work because they get sick. Those are, for example, just two of the many things that this administration did that need to be overturned. There are also administrative actions that the secretary can take to do things like provide and open an enrollment period. So all the people who have lost their healthcare coverage because of this pandemic can get their coverage with financial assistance under the Affordable Care Act, and that the government will restore the funding needed to educate people that that option is available to them. So while we don't know the specific agenda, these are all issues that Xavier Becerra has talked about and fully understands. And we certainly all know that this administration, the incoming Biden administration, will turn the clock back and move forward.
The day he's confirmed or before he's confirmed, the transition team has been working on language to reverse a number of these decisions so that he will not have to start from scratch. They will have already done the work, including issues of women's health that have literally been sent back to the dark ages by this administration. So the transition team does not only identify individuals, but they're identifying policies that need to be reversed immediately, both by the president as well as by the secretaries.
Mitch, any other questions?
If any of our reporters on the line have a question, you can raise your hand. Looks like that's it for today, Leslie.
Well, I want to thank our two Secretaries of Health and Human Services for their careers of helping people in this country get affordable, quality health care, for all they did while they were in office at HHS and all they've done ever since. And thanks to everyone for joining the call.
Thanks,
Thank you all.
Leslie.